And my question now is more related to being a McKenzie clinician. And if you are, you want to use the method on your practice, and how do you advise people, like there is a way that we can build that through insurance, or do you think it's just better to go cash-based? Because we know the system with the units, that we have to charge different units when we work in clinics that take insurance. So what is your insight on that?
Yes, I have a hybrid model. I have cash and insurance. So there are certain insurances that I just am not a network in because of the reimbursement component of it. And because of that, I charge those patients cash. And it's a prorated fee depending on how much time I'm with the patient, 30 minutes, 45 minutes, or an hour. They pay based on that. So I think it just comes down to personal preference and what you feel like your value and your worth is as a physical therapist and your time. If an insurance company is paying you for that time in a price range that you feel meets your value and your worth, then I don't see any reason why you wouldn't be in network with that insurance company to get paid that way. If you don't feel like they're meeting your worth and what you do and what you provide, then definitely it's something you have to consider going out of network or just charging cash for. I know as MDT clinicians, we feel like we're giving something more than just the box of physical therapy where they send people through working in groups of 5 or 6, and you've got someone who has not been trained even as a physical therapist. You know, I was a technician as a younger person, and I'm very grateful for that experience I had, but I didn't know what I was doing. And so I was working with 5 or 6 people on a mat, taking them through exercises, and physical therapists come out and check every once in a while and then go back to the back or work with another patient and then come back out and check. And then they're billing, 3 or 4 units for those kind of things. So, and then you go out as McKenzie trained physical therapist, and what you're looking for is that one-on-one interaction, the ability to see the immediate change that occurs, to be able to modify things according to the response and the assessment that you're performing. So billing for that is truly your time compared to when you're sending them out to work with a tech or an aide or someone like that, where you're billing now for someone else's time. So you just have to figure out what works best for you as far as your value, and then go from there and make the best decision that way. I feel like a hybrid model works very well for us. It's helped quite a bit as far as helping negotiate other contracts as well. We can say, we'll just go out of network. And some insurance companies are willing to keep us in network based on our outcomes and some other things that we do. So it's definitely something to consider, even a hybrid model that may work for people.